Hello, my name is Simone Mazilu, and today we'll be presenting on how to successfully onboard clients. Additionally, we will also go over the process and steps that it takes to write a clear and impactful treatment plan to improve client outcomes. We will be piecing together all the steps that go into compiling a comprehensive treatment plan that's created based on carefully selected assessments with an emphasis on writing treatment goals based on relevant cultural factors. So we will begin with a training overview. This training will include a walkthrough or a step-by-step guide on how to fill out the client onboarding and service plan template that was provided to you along with a handout that will act as a reference guide for this presentation, and feel free to follow along with that handout as well. Additionally, there will be an interactive quiz that will help you apply your skills to your real life scenario. I will provide you with the best tips or practices to use to make the process of client onboarding a successful one. Finally, we will conclude with resources that I will provide to you that can help further your understanding of this training. So, as clinicians, it's essential to select the most appropriate assessments to accurately identify a client's skill deficits. The summary of assessment results will guide you in choosing interventions that are both meaningful and effective, supporting skill acquisition and addressing, reducing, or replacing maladaptive behaviors. This treatment plan is a comprehensive document that outlines the goals you're prescribing to help the client build social communication and even adaptive skills. This plan should be shared with key stakeholders, including the client's parents or insurance providers or any other kind of outside service providers, to ensure the transparency, alignment, and treatment acceptability. So, therefore, it's important to write clear, relevant, and impactful goals. Doing so increases the likelihood of gaining parental consent as well as client assent, which ultimately contributes to stronger engagement and improved client outcomes. Overall, this training will help to improve clinical practice by helping you take an assent-based approach to writing a treatment plan. So, the objectives today, I'd like you to walk away with the following 3 takeaways. So, first, I hope that this training will help enhance your clinical understanding of how to write treatment plans. Additionally, I hope that it provides you, the clinicians, with a step-by-step guide on how to select and write treatment goals. And lastly, I hope that this training will help you recognize the significance of incorporating parent and client interest into treatment goal selectivity. So now moving on, filling out the onboarding and service plan template, we'll discuss how to fill out each page. If you could please bring out your client, the template, we'll now go through each of those pages. So we'll start with the first one. So this is the first page that includes all of the basic client information. And I've noted here that I want to highlight the importance of filling out the diagnosis, because with a lot of clients that you may see that they have other comorbidities. And these comorbidities can actually help provide an explanation to any other skill deficits that you might see outside of an autism spectrum disorder diagnosis. So additionally, now on the next page is the client history. So a question for you: what diagnostic information do you see here that you think would be important to fill out on this template? I'll give you a second to review. If you said anything at all about outside services, you're correct. It's important to fill out this table and recognize that outside services need to be provided here so that it can promote your future collaboration efforts with a speech therapist or even an occupational therapist. So it's important to write down the information about other outside service providers, because speech therapists and occupational therapists can be addressing some of the other skill deficits that you see with your clients, like oral motor skills or gross motor, fine motor skills deficits. So it'll be important to make sure you have their contact information listed here. Next, we're going to move on to the assessment results analysis. And you can fill out this table to help drive your decision on which assessment to use to assess these skill deficits. So, for example, you can examine the social validity or essentially how meaningful this assessment would be to the client. So, for example, if your client is nonverbal, it wouldn't be so helpful to obtain an assessment that really focuses on a learner who has a lot more verbal language skills. So, additionally, you also want to provide the assessment results and the indirect assessment reports as well in this section. And for goal setting, what skill acquisition areas do you see here on the template that you should reflect on when writing treatment goals? Again, I'll give you another second. Social interaction and communication and adaptive. These are the skill acquisition areas that you will want to fill out the goal, social validity, and baseline that you are observing in direct therapeutic services or treatment sessions with the client. For the behavior reduction targets, you're looking at similarly, like we were looking at the skill acquisition areas, here you're looking at different sections like throwing behaviors or maladaptive behaviors, or as we saw in the previous slide, the aggression kind of behaviors. And this table was formatted this way so that it can provide a comprehensive rationale for why you are targeting these behaviors. And for the service expectations, you want to make sure that you are proposing the appropriate amount of hours of ABA therapy that you believe your client should receive each week to the client's insurance providers. And you want to include as a part of that any parent training that you're doing, which will be important because parent involvement plays a very important role in client outcomes and treatment sustainability. Moving on to our last page here in the template is the service adjustment and client monitoring procedures. Here you will explain how you will be making database decisions to drive any changes that you or adjustments that you make in the treatments that you provide to the client. Something that I do in my clinical practice are weekly data reviews, which involves graphical analysis. I attend team meetings where we discuss the client's progress, and then I also conduct weekly parent trainings. And some common challenges. We'll do a quick pop quiz here. What do you think the challenges are when it comes to writing a treatment plan? If you said identifying skill deficits and treatment acceptability, these are both challenges that you definitely see when writing a treatment plan and showing it to, I suppose, discussing it with the relevant stakeholders. So for identifying skill deficits, if you don't select the right assessment tools to be able to identify skill deficits, you may be targeting a skill that is not necessary to target. Maybe the client already has that skill, or maybe they're missing the component skills that are required for the skill that you're trying to target with a treatment goal. Additionally, treatment acceptability, because if treatment goals are not perceived as meaningful or impactful by the client or even their parents, then you're not following that assent-based approach because you wouldn't be getting the consent from parents or the assent from the client to even participate in these treatment interventions. So now we'll move on to a real-world example. I'm going to refer to this client as client X. So quick client profile. This client really loved to read books. He had a lot of language, but he was not readily using that all the time. He did not engage in a lot of distress behaviors, though. And so what my supervisor did was carefully select the most appropriate assessment to assess his verbal behavior skills because, like I said, in the client profile, we saw that he had a lot of language. Next, she conducted an error analysis based on those assessment results. And she also referred to the client and family's interests so that it would drive the creation of these treatment goals for the client so that it would make them meaningful and impactful for the family, which would promote treatment acceptability. So some tips that I gathered while working on that case with client X was the importance of carefully considering the assessment selection that you use. Also, consider the cultural relevance and social validity because, again, you want to make sure that you're following an assessment-based approach and obtaining. Okay, cut this out. And obtaining treatment acceptability from the parents. Lastly, you want to write clinically appropriate treatment goals that will target the identified maladaptive behaviors that you saw during your direct observation when first meeting the client. And those are all ways that can help you avoid those common challenges that we talked about when writing a treatment plan and during the client onboarding process. So moving on to this interactive quiz, on your handout, you will see that section where you can actually mark with a pen or fill out what the correct answer is. So for this first page, I wanted to ask, what do you think that this client has trouble with? And let's review the client profile. Her name is Daisy. She's 5 years old. She's interested in Disney movies. Her parents say that that's actually where she first learned to first speak. And she engages with her siblings somewhat while watching these Disney movies by trying to describe the scene that she's seeing on the screen. And so her parents have requested that you focus on helping the client expand her language skills. So again, taking a look at this chart, what does the client have trouble with identifying? And the X's mark the errors that she made on these assessment questions, and then the check marks are where she got it right. If you said nouns and verbs, you would be correct because we see a lot of errors in these two columns here. And again, this is the same client, but a different set of assessment questions. And what here in this table do you see if you were conducting an error analysis that the client has trouble with here? Again, nouns and verbs. We can see that she is having trouble with identifying these two areas from the assessment, but she does great with adjectives. And the last question that I have here on this quiz comes from a component composite map. And I didn't get to talk much about this during the presentation, but this is what, for client X, what his clinician moved on to after conducting an error analysis. So essentially, what she identified was that, well, let's take this case of Daisy here. So her parents would like her to work on expressive labeling or expanding language, right? So you could start to work on expressive labeling of a picture, which is what she's already doing, but she's having trouble and needs this skill strengthened. So you're going to take a look at the component skills or the simpler skills that are needed to make up the composite skill of being able to expressly label or describe a scene. So the treatment goal here would be describe a scene, or I guess expressive labeling. And the component skill that you're going to work on when you create that instructional design sequence is in these component skills that are left blank here. Try and fill out what you think Daisy would need to learn to be able to learn how to describe a scene or expressively label. If you said verbs and nouns, you would be correct because that's what we saw in the error analysis, and that's what we would put here in this table as the skills that she needs to work on in order to be able to participate in watching a Disney film with her sisters. And in conclusion, I want to wrap up with a discussion about the key takeaways from this training. So first, I want to highlight the fact that error analysis is very important in order to ensure that you're identifying the skill deficits that a client currently has and use the results of this analysis to drive your proposed treatment goals. Next, social validity. Remember to consider the client and parent's interest when developing the treatment goals so that this will help drive you to promote treatment acceptability and ensure sustainability, that the plans continue to work on these treatment goals outside of the session. And ultimately, again, this will lead to improved client outcomes. Lastly, I just want to provide you here with a link to a resource that talks more about the ascent-based approach that I discussed throughout this presentation. You want to make sure that that's the approach that you're taking when writing this treatment plan, so that, again, you really are focusing on helping ensure treatment acceptability and sustainability. Thank you for listening to my presentation.